There are many resources you may use to find scientific articles, but since it has a huge collection and it is free to access, in this course I will follow the PubMed. I will use the PubMed to derive, to search for the article types. So one question might be, which of the following study types are most frequently encountered in PubMed? Which of them specifically most frequently, and what would be the order if you should put them in a increasing or decreasing order? Yeah, I also wondered this, and I made a search using PubMed, and it comes out that cross-sectional study designs, cross-sectional studies are the most common, one of the most common, of course, clinical trials. If you search the PubMed for clinical trials, you have a larger hit, but actually this term clinical trials might include also some other, I didn't check individually whether they are all these 700,000, it's not possible, really clinical trials, but the clinical trials and cross-sectional study designs are the most commonly encountered study types in PubMed. And we have, of course, also a lot of case controls, similar number of case controls and case reports. In the coming slides, I will give examples of that. And then comes, in decreasing order, we have the cohort studies and the similar number of meta-analysis. Why the number are lower? Not because their evidence is low or they're useless or worthless, because it is more difficult to conduct, time-consuming and resource-consuming to conduct a cohort study. Meta-analysis is not exactly, we cannot tell that meta-analysis require a lot of money, but they require a lot of time too. So they are also, the number of meta-analysis is increasing in the recent years very rapidly, but still they are of course not the most common study designs, because meta-analysis use the other study designs like clinical trials or case control studies to produce a new report. Of course, guidelines are also not very difficult to produce and require a lot of time, and there are not so many of them. If you search, enter the PubMed, under the search options, you have these checkboxes where you can refine your search. And under the article title, article types, you will see, once I counted it, it was 77, I think, but tens of different article types you may see. So most of them we don't encounter so frequently, and you may not use in your future careers. But case reports, for example, or clinical studies, or these phase studies, phase 1, phase 2, phase 3, phase 4, etc. And what else? Not listed in this slide. There are other cross-sectional cohort meta-analysis type studies are very important. So I will give you some examples in this presentation. Using the PubMed search, I will give you some examples of these frequent study designs. We have the broad heading, the observational studies. Under the observational studies, we have the cross-sectional studies, the case control studies, the cohort studies. These are the most frequent ones, the most important ones. So PubMed has categorized, made a broad, big category, including the observational studies. In an observational study, as the name implies, you don't do an intervention, you just observe. So if you're just observing, because the other type, the opposite of observational studies would be experimental studies. So if you're not doing an experimental study, you're just observing, and then you have the observational study design. The primary reporting guideline, the most commonly used and suggested, is the strobe. And even some scientific articles, they mention this in their title, as you see here in this example, a strobe compliant article, that they are proud, they have followed the strobe guidelines when they were writing their report. And here is a screenshot of the strobe statement, the strobe checklist. The strobe checklist has, as I remember, 21 items, or around 20, more than 20 items. And all the checklists or all the reporting guidelines are similar. They give you information or guidance about all the different sections, different aspects of a scientific research. So in a scientific report, in a scientific report, you have, of course, first of all, the title, and then comes the abstract, and you have then introduction, methods, results, and discussion, and so on, and references, of course. So how should your title and abstract be structured? What should be included in the title and abstract? As an example here, you see the study design. Study design is preferably included either in the title or in the abstract, whether it is a case control study, a randomized control study, etc. The introduction is also subdivided into categories, the methods, all the subheadings have also their subcategories. So let me repeat again. If you have an observational study, which may include case control, cohort, or cross-sectional, you are expected to follow which reporting guideline? The strobe guidelines. Okay. Then we have the case reports. Case reports are also very frequently encountered in scientific research, and they're important. What are case reports? Case reports present specific cases which have some extraordinary or important features, like extraordinary, an uncommon presentation of a clinical condition, or an uncommon, a rare side effect of a medication, or anything you believe that this case, although it is a single patient or single condition, you believe that it has a value for the readers, the clinicians, the practitioners. They will benefit from that. You write it, convert it into a paper, and report it. For the case reports or case presentations, we have the care guideline. Care guideline is specifically designed, developed to help scientists to write a case report. As you see, also the care guideline, similar to the strobe, has in the checklist informations about the title, the introduction, the methods, findings, discussion, etc. Here, an example of a case report. Let us see what was the motivating factor to publish this patient. This is a patient, intractable ascites associated with mycophenolate, okay, mycophenolate in a simultaneous kidney pancreas transplant patient. So that's a condition you don't expect, actually, ascites, when you give mycophenolate in transplant patients. And that's why I believe the authors listed here, they found it interesting. And the journal editor also, it was published in PMC, as you see, Biomed Central Nephrology Journal. So they found it worth to publish this case. Another study type is the clinical study. Clinical means, if you hear the term clinical study, it means it involves research using human volunteers. So it is on human. They can be further categorized as observational or experimental. Clinical studies can be also experimental, of course. So you have observational clinical studies or experimental clinical. If you're doing an experiment, then we call it usually a trial, a clinical trial. In this case, clinical. So these are very similar, to some extent, synonymous terms, as you see, clinical trials. And then there's the study design. The classical study design of clinical trials is the randomized controlled trials. Of course, a randomized controlled trial may not include human. If it is including human beings, it is a clinical trial. But you may also do a randomized controlled trial in a laboratory on the cell cultures or on animal, doing an experiment on animals. Randomized controlled trials are experimental study designs, and they have a control group and at least one control and one study arm. And the objective is to compare a new intervention with already used one. So the example here, cardioprotective effect of succinate dehydrogenase inhibition in rat hearts. So this is an animal study, as you see. Here they have used the rats for this study. And also beyond the rat hearts, human myocardium, with and without diabetes mellitus. So there is one group with diabetes, another group without diabetes, and they checked cardioprotective effect of this medication. Okay, and very important also, because this is one of the most frequently done research type, and very also in the evidence pyramid, it is high ranked. The randomized controlled trials or the experimental studies, they have also a reporting guideline, which is called the Consolidation of Standards in Reporting Trials, consort statement or consort checklist, you may call it. And this checklist, as you see, also very similar, just modified according to the individual study design. By the way, there is this equator network where you may find all the different equatornetwork.org, all the different checklists or reporting guidelines for the different studies. Okay. Also here, some studies you may see that they are reporting even in the title, they're including that they have done their study using this consort style study, consort guideline. Okay, another study design or study type is the clinical trial protocol. Actually, protocol is the methods, the description of the methods of the study, how the study was conducted. So any study design, even case control studies, cohort studies, they may have a protocol. They have a protocol, of course, but they may have a separately published protocol. So it is for the clinical trials or also for other study designs, meta-analysis, cohort studies. It is frequently observed that the researchers, they first publish their protocol, they first write the protocol, because the protocol is the main effort and main mental effort behind this research. So they first write and publish their protocol, their methods, how they are going to conduct the study. And then they do the individual research. So in PubMed, you may also see publications called Clinical Trial Protocol, which is actually the research methodology of a clinical trial, which will be conducted afterwards. Just to allow you to breathe a little bit, another quiz question. After which clinical trial phase does a medication receive official approval to be used in humans? Actually, with this question, I mean, when does a drug, when it which is in development, after which phase it enters the market, it is possible to prescribe or to buy from a pharmacy. So you see that from the options that we have, the phase 0, 1, 2, 3, and 4 studies, 5 different phases of studies. These are the clinical trials, of course. I will not go into the detail of these clinical phase studies, but there is a nice Wikipedia site for this. So please refer to this and read from there. What are the goals, the number of patients, etc., regarding the phase studies. Before the phases, of course, phases are done on humans because they are clinical studies. Before the phases, you have the preclinical studies. That means preclinical, before the phases start, you must do, of course, non-human studies, research. A phase 1 example now, phase 1 study, receptor occupancy of dual glycogen-like peptide 1 / glucagon receptor agonists, then this number of the product in individuals with type 2 diabetes. As you see, it is not a drug yet, it does not have a name, it is just a compound which is under development, and the researchers, the scientists, they are behind to find what kind of effects it may have in type 2 diabetes. If you open this study, you read it, you will see that the number of subjects in a phase 1 study, because it is early stages of the development, and there is not enough information about its side effects of this compound, the side effects, the risks of this compound. It is done on insured volunteers and very less number of people. Here in this example, only 16 subjects. Then if a product passes the phase 1 study, then it is allowed. And these phases, by the way, they are regulated by the governments. They are government agencies where you have to apply and take permission, and it is not easy to do this. It is it requires a lot of intellectual knowledge, experience, money, of course, and time to conduct the phase studies. And therefore, maybe most of the phase studies are supported by drug companies, actually. So phase 2 studies, they are, of course, they have already passed the phase 1 level, and they include this time more participants, more number of participants. Here, one phase 2 study titled Golimumab and beta cell function in youth with new-onset type 1 diabetes. So a product, a newly developed product, which is expected to be effective in type 1 diabetes. And they have checked its effect on the beta cells, pancreatic cells. Okay. A phase 3 study. Phase 3, the answer of the quiz now comes. Phase 3 is the level when a product, a medication, a medical drug enters the market, when it receives approval to be prescribed to people, to patients. And this example here, let us read the title: Safety and Efficacy of the BNT162b2 mRNA COVID-19 vaccine. So this weird name actually is what you know as the BioNTech vaccine. This is what you know as the BioNTech vaccine. Here the name of the BioNTech CEO, Uğur Şahin. So if you would like to read how the BioNTech vaccine received, on behalf of which kind of evidence it received approval and entered the market, you should go and read the protocol, the methods of this research. If I just a screenshot from this report, you see in the objectives part, they mention the phase 2-3 part of a global phase 1-2-3 trial. So thus this project which they are running there, it was a phase 1-3 trial, and this part they report is actually, although I show it to you as a phase 3 study, it is a mixture of phase 2 and 3, because you know this COVID pandemic, it developed very fast, and the studies also needed to be sometimes conducted very fast and merged. So what is then a phase 4 study? A phase 4 study, already you should be able to tell now, if you listen to the previous slides, that phase 4 is after the medication is already in the market. So it is a post-marketing study that we call the post-marketing. It's already in the market. Post-marketing. What is then the purpose? Post-marketing. What is the purpose then of this study design? You have a medication which is used for one indication, but it is safe to administer this medication to human beings. So you may wonder what kind of side effects it has, what kind of effects it in different age groups, in different gender, sex groups, in different racial subgroups has. If you are conducting a clinical study on human beings with a medication already approved to be in the market, and you want to see some other benefits, looking for maybe some other indications of use, then we call this a phase 4 study. Repurposed uses, you see, repurposed, another purpose, looking for another purpose. Immunomodulatory drugs, for example, in COVID-19. And an example here is linagliptin compared to placebo, whether it improves the progenitor cells. Progenitor cells, what are these? These are cells which have the potential to convert into other cell types, like the stem cells. So in this study, they checked in chronic kidney disease patients and diabetic, type 2 diabetic and chronic kidney disease patients, whether this product, this medication, could have some benefit on the progenitor cells. That means, is it possible, can we expect that this medication will have some cellular regeneration maybe? So a product already in the market and doing another research with this one, we call it the phase, if it is conducted in human beings, it is the phase 4 study design. Good. So far, the phase studies. Now, guidelines. As I mentioned in the beginning of the presentation, guidelines are not so frequent publications because they require months or years sometimes to develop a new guideline. It is not an easy job. And on the other hand, we don't require actually so many guidelines. We need guidelines for the for following up or treating or diagnosing health conditions. Okay. Here one example again, non-alcoholic fatty liver disease, a clinical practice guideline for this specific condition. So guidelines are for specific conditions. They may be diagnostic guidelines or therapy guidelines or follow-up guidelines. And common guidelines you will see for hypertension, how to manage hypertension, for COPD, asthma. The GOLD guidelines, for example, are very famous. And for all sorts of common medical conditions, you may go and find some guidelines. How to diagnose and treat painful urination, urinary tract infections, how to diagnose and treat sore throat, upper respiratory tract infections. Any disease you can imagine, it is possible to develop a guideline. But when it is a rare disease, of course, because this requires, the guideline development requires a lot of efforts and budget, you may not find guidelines for the rare diseases. So the guidelines, also sometimes called as practice guidelines or clinical practice guidelines. Here, one title, Screening of Potential Cardiac Involvement in Competitive Athletes Recovering from COVID-19, an Expert Consensus Statement. So in this guideline, actually it is the guidelines also graded according to their seriousness, to their evidence level. And when it is it doesn't have so high ranking evidence, then we call it an expert consensus statement. This one here, this guideline, is developed for checking or screening potential cardiac involvement in athletes who recovered from the COVID-19. You see, you do, if the patient has the symptoms, you do the 12-lead ECG and then echocardiography, and depending on that, you decide which way you go in the diagnostic process. Also, for the guidelines, we have a checklist or a reporting, the guideline of reporting guidelines. The guideline of reporting guidelines is called the AGREE checklist or the AGREE guideline. And yes, it's enough, I believe, that if you know the name of this guideline, the AGREE guideline. Letters are another study type. Letters to the editors, letters to the readers of scientific articles. One example here, a letter published in Pan-African Medical Journal, what is the title? COVID-19, do it like Greece. Why Greece is coping with COVID-19 better than other countries. So it is just a brief opinion and short paper on the subjects written by also scientists. Then we come to an important topic in the group of studies in the study design, study types, namely the reviews. The reviews, there are many different types of reviews: narrated reviews, scoping reviews, systematic reviews, and one step further, we have the meta-analysis. And reviews compose also a very important part in the evidence pyramid, in the evidence bringing materials to the practitioners. Let us read the name of this review: Obstetrical and Gynecological Challenges in the Liver Transplant Patient. So they are not conducting an experiment, they are not making an observation, they are not having a cross-sectional data collection, they just focus on one topic and collect the accumulation of the evidence available and make a summary to you, to the readers. This is a review. If you have a systematic search of all available resources, then we call it a systematic review. In a non-systematic review or in a narrated review, you are the expert and you just go and read the literature and summarize it to your readers. But in a systematic review, you systematically search all available evidence. You don't suffice with PubMed, for example. You go and you look also for the other resources, like Embase, as you see here. You see, this systematic review included which databases beyond the PubMed, Embase, CINAHL, Web of Science. So systematic reviews are, of course, superior in comparison to the plain review types or non-systematic review types. Meta-analysis is also one type of systematic review, but the difference is after you collect your evidence, you extract some data from that. You extract some data and you make another analysis. You pool your available evidence and you report a new summary of the findings. So while in the systematic reviews or non-systematic reviews, you just mentally summarize what you have, verbally summarize what you have, what you found. In a meta-analysis, you also report some numbers, some figures, some confidence intervals, a pooled summary of all the available evidence. Therefore, of course, a meta-analysis is on the top of the evidence pyramid, and it is very important. Yeah, what is the name of the checklist or the guideline to report a meta-analysis? It is called the PRISMA. You may also find some other guidelines, but the PRISMA guidelines are well known. One title, one example, metabolic risk factors and risk of COVID-19, systematic review and meta-analysis. A systematic review and meta-analysis. So what you understand here from there, you may have a systematic review without a meta-analysis, but this study did a systematic review. So systematically, they collected all available evidence based on some keywords. They collected all the available evidence, and then they summarized this in new figures using the meta-analysis. So they did an analysis before they reported. The final study type is the patient. There are many, as I said. Only in the PubMed you may find more than 70, but patient handouts or patient education handouts you should be also familiar with. This is also one study type you may find interesting and you may want to conduct. Here, what you should know about type 1 diabetes. So this publication is targeting the patients, the people who are supposed to read an information about the condition. It may be anything related to the health. It may be a preventive information, it may be a screening information, or management or treatment of a disease. In this example, they broadly report about diabetes, what it is, what are the causes, the risk factors, and how it is diagnosed, how it is treated, etc. So that was it for today. If you have watched this presentation from the beginning, you should be able to explain the features of at least 5 different scientific article types and the related reporting guidelines for these 5 most commonly used study designs, study types. Thanks for attending. Thanks for watching. Hope to meet you again. Bye-bye.